My name is Michael. This is my wife Jessica. We started coming to this clinic early last year in 2023, and they were helping me out a lot, and it was helping me stay alive. But some of the things that was going on with me couldn't be figured out. So that's when we got introduced to Dr. Chan, and it really changed my life. I feel like so much healthier and stronger. If you could see a before picture of me from early last year, you would understand. I was in pretty rough shape, so I'm thankful for the...
Michael, you can see at the beginning what happened, and for the last 5 years, what was some treatments you have undergo and things like that.
Okay.
Yes. So because we need to know roughly before what was the situation and what sort of treatments you have done and to what level.
Okay.
And to be honest with you, when I took up your case, I dedicate the treatment with you is because my own father died of liver problem, complication.
Mm-hmm.
And his only brother died of liver cancer. And my mother, 4 brothers, 3 of them died of liver cancer. Mm-hmm. And my only surviving uncle from my mother's side is a hepatitis B carrier. And I'm the male child, so can you imagine the risk of liver here? On my side, I'm also run a big risk of having liver cancer then.
Yeah.
Because all the uncles, 3 here and 1 there, and my own father are all related to liver. And I don't I work very hard,
Right.
16 to 18 hours a day. That means my liver is not resting the right way.
Right.
So I monitor my own liver very carefully too. I don't mind telling you.
Makes sense because
Exactly like what I'm giving you, I'm giving it for myself, my liver. Although I don't have any problem with my liver, but when you work too hard and you don't sleep between 11 to 3, that is your liver hour. That is the time your liver need to regenerate.
Okay.
So treating you is like a dedication for my own father. When I cannot do it for my own father.
I am very grateful for that, because
Yes.
what Michael was trying to say earlier is having dealt with genetic cancer and been a roller coaster for a few years, he got into trouble in late 2022, and I was told to take him home to die. And our last resort, a friend told us about the Cancer Center for Healing and Dr. Keneally. We arrived here January 2nd of 2023. And Michael was in pretty rough shape. The treatments here were wonderful. They saved his life, brought him back to life to a certain point, but there were still some issues going on that were unexplainable, and just couldn't quite get his body to respond to. And that is when Dr. Keneally introduced us to Dr. Chan in June of 2023. We ended up going forward with the stem cell therapies for his liver, spleen, brain,
Yes.
thymus, and heart was the first set of transplants. And within a few weeks, we could already see the difference. He could feel it, and opted again for a second round of liver in October on his 50th birthday. And since then, all the monitoring after that, blood work's coming back better, scans are coming back better, more and more things are improving that we didn't even expect to, and it's amazing to see where my husband was a year and a half ago as opposed to where he is now. It's incredible, and your research is giving me my husband back.
Thank you. I just give you a rough idea what I did for Michael here. Now, when we took up the case, we were analyzing in a lot of ways because you were at the very chronic stage at that time. Okay, it was kind of an end stage situation,
Okay. Yeah.
So, but I was telling myself, what do Michael have to lose here? He don't have anything to lose. If we don't continue with this treatment, it will be continue to deteriorate. So I was telling myself, if I can do something for him, why not? I couldn't do it for my own father, I couldn't do it for my own uncles, but now I can have a chance to prove to super boost his immune system and in a way to regenerate the liver. The liver itself can be regenerated even if you cut 90% of it. It's the most regenerative organ and is the oldest organ in your body. It only starts to age at 75, while the rest of the organ like your heart start to age at 40, and your spine start to age at 11, and the brain start to age at 20. So for the liver, it's a very different way of looking at it. But again, when we are talking about liver cancer, it's something which is very, very sensitive, So I always say, don't give the cancer stem cells to treat cancer patient. But in Michael's case, we are thinking of in another way. Most of the time, we always give the peptides. So what we did for Michael is I did give the liver cells. I did give a huge dose of thymus cells to super boost the immune system. We gave the spleen. Along the way, for Michael, he's at his age, close to 50. He's also aging along like any one of us. So along the way, I did give some other organ cells to regenerate his organ. So it was a total revitalization, but the main target was we give a quad dose of the liver cells, a quad dose of the thymus, and we follow with the peptides, of the thymus and the super transfer factors. These are mitochondrial peptides to super boost the immune system to the extent that it will recover to faster than it should be, because we understand the liver can regenerate very fast. This is what we learned from my own experience of 40 years, spending a lot of my time with the Germans and the Swiss, and we've been contributing a lot of books. This is one of the books on biological medicine. This is what we thought of, You have to regenerate the organs, and this is what bioregenerative medicine is all about. So, basing on this belief and with the experience of thymus therapy, which has been used in Germany for the last almost 200 years, we learn from our masters and we apply the same principle to what I did for Michael, and I can see the improvements has been tremendous. And I was told in the beginning and shown that even the liver was out of shape totally. Okay, today you have back the liver in a proper shape, and I heard just today that the transplantation organ specialists will say you don't need a transplant anymore.
Yeah.
Right.
Okay, this I have to heard from you, because I just arrived. I do not know what they say. Yeah.
That phone call came a couple months ago. They had been monitoring Michael and preparing him to put him on the transplant list early last year, and a couple months ago after his last scan, he said, we don't normally see the regeneration. We're still going to monitor you, but there's no need right now.
I'm so happy to hear this.
Mm-hmm.
You obviously will not need that anymore.
No.
Okay, just monitor the liver, and you will keep them in good shape, and we will continue to put you in the best of health from here.
Yeah.
And I'm so happy to hear all this news. It may not be the first patients we have done with all this, but it matters a lot to me. Especially to Jess, who has been keeping so good care of you.
Yeah, she has been.
When she say I got my husband back after 5 years, it matters a lot to me.
It means
Very
a lot
much.
to me too.
Okay. Yes. Remember when we first met here? I was giving a lecture with the doctors. And your file was shown to me. And at that time we do not know whether to take it up or not to take it up, because we have already looked at the file.
Yeah.
But I really make the decision that I must do something for you, because I can see that from the face of Jess and you really need the treatment very much,
Yeah.
So I'm so happy that we finally managed to make you back to the original stage,
Yes. Yeah.
before you have the liver problem.
And I feel like I just keep getting more and more
Yes,
healthy.
you will.
Um,
With a strong liver, your whole body will regenerate too, because the liver is responsible for the metabolism of your whole body and your hormones in your body.
Right.
Yes, just we only have to monitor it all the time and put ourselves in good shape.
Yeah.
Okay. Yes, of course. With the diet, the lifestyle, we have to continue with a good lifestyle. That is important.
Gotta take care of it.
Yes. And I have to commend Jess for doing everything for you. She was telling me everything, everything is all in details,
She must,
And
she's.
You have the best person with you.
Yeah.
Yes.
He's my
It is not
person.
possible without Jess too. I would say that. I would say that.
I
Yes.
believe it.
Yes. Okay.
Yeah.
Good. Thank you.
Just the journey has been scary, a lot of it,
Yes.
and then now I feel confident about the future and moving forward, and just gaining my life back, because it's been several years of
Yes.
just really, really hard times. So
Yes.
yeah.
I will always say there's always a solution, because all the organs can be regenerated as long as they are living tissues. Even if they are dying in any organ, they can be regenerated. More so with the liver. And I'm so happy to have a chance to see you today after the 6 months we have not met, and we did give you a booster after that, and I have to thank the center for monitoring you closely. This is important. All this would not have been possible if the center has not sent you to us. Yeah. So we have to thank everyone here. Everyone did a good job, I would say.
Definitely.
Okay.
Definitely
Yes.
good.
Yeah.
The whole experience has been
Yes.
good.
Yes. So what do you like to tell the world for people who will be in similar condition like you?
Well, like Dr. Chan was saying about his father and a lot of his family, I have the same genetic mutation as my mom did, but she also had a weak liver. But that it wasn't. I don't know. It might have been part of it. I don't know.
Yes.
But anyway, she always struggled with her liver problems,
Mhm.
and she fought really hard, but she could never get healthy enough to heal her body. You know. So and she passed away when she was 65. So that's pretty young. So knowing that I have that same genetic disposition, sometimes you get in your own head and you feel like, oh, there's nothing I can do, you know?
Yeah. So do you think your message to the world will be there is always hope for everyone, even with a chronic or even with liver cancer to a certain extent?
I would say so.
Your
Yeah.
mom would be here if she had had the option to have done these therapies. She would still be here. She did not have those options.
Yeah.
Yes.
Yeah.
Yes.
Yes, definitely.
Do you think it will be, Jess, on your side, what do you think? Would there be a hope for any other people like Michael condition?
Just, you'd have hope. I watched him give up last year, completely give up and just tell me, they told me I'm gonna die and have no hope. So he knows how that feels, and I know how it feels as a loved one, watching your loved one just give up. Don't give up. There's always hope. And there's a lot of people out there and a lot of doctors that will just give up on you. You have to be the ones to keep pushing. And this is something that there's always gonna be, just keep looking. There is hope. And
There
Dr.
is hope.
Chan gives you
Yes.
hope.
Yes.
And he gave me my husband back.
I'm happy to hear that. So to the rest of the world, there is always a solution, like I say, as long as there are living tissues still in the organs, you can do the regenerations.
One of the things I appreciate very much about Dr. Chan is that he's always trying to reach out even after the therapies, just trying to check on me and make sure that everything's going okay, and that he's very busy. You know, he's got a lot going on, but he reaches out to me, to us, and I wouldn't really expect that from anybody else, but I do appreciate it, and so that was really special to me too.
Thank you. I do that for everyone because if we have to treat a patient in my medical team, I always tell them, you must treat someone with a heart. The heart must be there. Imagine if you have your parents or your siblings treated by another doctor who don't show the compassion. We all must be with compassion when we treat the patient. This is what I used to tell to all my hundreds of doctors in my employment in our centers across the world. I love what I'm doing very much, and we would like to give the best to all the patients of the world who come after us. When we take up the case, it is our responsibility to ensure that the patients will continue to improve to the best of health. Yeah. I thank the center for making all this possible at the same time.
Yeah, we
Yes.
do too.
Yes. Remember, the best doctor for yourself is you yourself.
Yeah.
So you have to understand a bit of your condition. Okay, because all the doctors in the world will never have all the time for you. But the doctors, the good, kind doctors, will always look and monitor the case of the patient for the rest of the patient's life, because that's the job of the doctor, to give the best. Our job is to enrich and heal lives to all extent. Thank you. Thank you.
Thank you.
Yeah.